Welcome, everybody. Paige, did you want to do the honor of getting our PowerPoint going? Thank you. Okay. Seeing folks joining. We'll get started in one more minute. Welcome, everybody. Get started in just a moment here. Okay. Oh, sorry, Mac. What was that?
No, go ahead. Nothing.
Okay. It's 1:02. We'll go ahead and get today's webinar started. Welcome, everybody, and happy Friday. Welcome to our Council on Criminal Justice and Behavioral Health Juvenile Justice Workgroup meeting today on February 11th, 2022. Hard to believe we're in February already, and this year is just flying by. My name is Brenda Graylish, and I'm the Executive Officer of the Council, and I am joined today by our two Juvenile Justice Workgroup advisors, which I'll let introduce themselves. You want to start with Denitza, maybe?
Good afternoon, everyone. I'm Denitza Pantoja, and I was appointed by the Speaker, Anthony Rendon's office, and I'm the Coordinator of Psychological Services for the Antelope Valley Union High School District.
Thank you. And Chief Jenkins.
Yes. Hi, everybody. My name is Mac Jenkins. I'm a retired Chief Probation Officer. I retired from the Chief's position in San Diego County, and I'm a gubernatorial appointee. I was appointed by Governor Brown during his term. So happy to see everybody, and I look forward to our session this afternoon.
Great. And welcome to all our participants, and thank you for spending your Friday afternoon with us. We have an exciting day planned today. Before we get started, I'm going to turn the slides over to Monica Campos, my special advisor, and she's going to go over a couple housekeeping items for us. Next slide, thank you.
Good afternoon, everybody. Thank you, Brenda. I wanted to go over just a few things with our participants today. Our work group is being recorded. So if you happen to know anybody that wanted to come to our work group but couldn't make it, we will be having a link available on our website. If you would like to make a comment, we ask that you use the raise your hand feature, and it will put you in the order that you requested. The host will then unmute you, will announce you, and then you'll be able to state your comment. We ask that you keep your comment to 3 minutes or less, as we want to give everybody an opportunity to comment. Also, if for some reason we're unable to get to you, or you want to put your comment in writing, we encourage you to send it to our email address at ccjbh@cdcr.ca.gov. We also wanted to go over some webinar policies that we have in place. We welcome absolutely everybody to participate. We want to make this as interactive as possible. But please note that any disruptive behavior is not aligned with the purpose of this session and will not be tolerated. Any disruption to the webinar session may render you being removed without warning. In the event of a security incident, this session will end immediately and will not resume. If this does occur, you will receive a separate email sent to your email that you provided at registration, and we'll give further instruction at that time. During commentary, we asked that we wanted to let you know that participant comments in the Q&A do not reflect the views or policies of our presenters, CCJBH, CDCR, and any affiliates or contractors. By using the Q&A, you agree to keep comments relevant to the topic of today. While a variety of diverse perspectives and opinions are welcome, disruptive comments are not aligned, again, with the purpose of this meeting, and users creating disruption will be removed without warning. So thank you, everybody, for participating today. Again, we encourage you to ask questions. And again, welcome, Ms. Lucero, and I'm going to turn this back over to Brenda.
Thank you so much, Monica. So our agenda today, got some exciting topics to talk about. We've done our welcome and introductions of our CCJBH folks, but we will be getting an update on the Juvenile Justice Compendium and Toolkit request for proposal. And then we'll follow that, of course, with questions and answers, Q&A with our council member advisors and public discussion and comment. And then, as Monica was mentioning, we have Ms. Lucero here with us today, our new executive director for the Office of Youth and Community Restoration. So a big welcome, Ms. Lucero. We're very excited to have you here today to talk about this really exciting office and your vision for it. After that, again, we'll open up for Q&A with council member advisors and public discussion. And then after that, we just have a few little announcements for everybody, and then we will adjourn our meeting. So very excited again for today's topic. Next slide. I'd like to introduce Emily Grishon from our CCJBH team to give our update on the Compendium and Toolkit.
Hello, thank you for that introduction, Brenda. So CCJBH's Juvenile Justice Compendium and Toolkit RFP was initially posted on October 14th, 2021, and it closed on November 18th, 2021. No bids were received during the first procurement, and after speaking with our system partners, it was determined that it was likely due to insufficient time to complete the application. The RFP was reposted on November 9th, 2021 with a longer bidding application, and it was closed on February 4th, 2022. CCJBH is now working to review and score the submitted bids, and we'll be working with the OYCR closely with our selected contractor throughout the duration of the contract to identify any areas for collaboration.
And just for the record, oh, thanks, Emily. Thank you so much for the update. I was going to say, just as a quick point of clarification, it was reposted on December 9th, and just for the minutes, because our team will take and use this. That's okay, Emily. Sorry, just so we're doing minutes. But thank you so much for that update, Emily, and for all the hard work you've done, I know, to coordinate this for our council. With that, I will open it up to our council member advisors to ask any questions or do any reflections or comments.
Well, I'll make a comment. One, and I've already shared this comment with you, Brenda. I was disappointed that there were no bidders the first time around, disappointed and surprised. I do hope that there are respondents this time around.
We do. We did have respondents this time around. So
wonderful, because the field of juvenile justice is important, and there obviously is a lot happening here in the state around juvenile justice, but there is a lot of research and evidence around how to work with the youth who enter the system, who really enter at different levels. So certainly part of the objective of the compendium and toolkit is to empower, even I would say, jurisdictions to take advantage of the research and not even best practices, but evidence-based practices to better serve these youth. So I'm pleased that we're getting some respondents this time. So I'm excited.
So were we. We were on pins and needles, Chief, because we were really looking forward to it. But it looks like that longer time period was what was most helpful for our bidders.
Wonderful.
Yep. Okay.
I just have a quick comment. I just want to thank your team, Brenda, because I know all the work that went into it, and I'm excited to hear who's selected, and just kind of echoing Chief Jenkins' remarks also. I think this will be great for, for all our partners and, the state of California working with our youth.
Thank you. And yeah, we were really excited to be able to get your guys' feedback and input and helping to get the vision for it and develop it. And then we've also been really excited since Director Lucero has come on board and her team starting to staff up, being able to make those connections with OYCR so that this can pass off to them as a baton so that they can, it would be a useful resource hopefully for them to use as they move forward with the exciting work that they're going to be doing to strengthen these services and these systems for our most vulnerable youth. So, okay, any other questions from councilors before we open it up to our attendees? Uh-oh, sorry, you guys. Okay, I think I thought I saw Liz Stanley Salazar's hand up. I don't know, Liz, if you still wanted to ask a question or had a reflection. Okay, I don't see your hand up anymore. Okay, well, oh, hand up again. Monica.
Absolutely. Okay, Elizabeth, you should be unmuted now.
Okay, it's a little confusing changing platforms 3 times a day, but I've got it. Hi, everybody. This is Liz Stanley Salazar. I do have a question. What's the expected time frame of the review and then notice of award?
I know we're trying to get the review done. Emily, you've got the time frame. Yeah. Okay.
Yeah, we should be getting the review done in the next couple of weeks, and the estimated contract award date is late March. So we're looking at like around March 20th, but somewhere around there.
Thank you.
Thanks for the question. Okay. All right. Well, with that, I don't see any more hands. Next slide, please. Page. Awesome, thank you. So with that, and without further ado, really excited again to welcome Executive Director Catherine Lucero here today to give the update on the Office of Youth and Community Restoration, which for those of you who may be new participants joining us today, resides under the Health and Human Services Agency here in California. So with that, welcome Director Lucero, and thank you so much for taking the time to spend with us this afternoon to share your vision for OYCR.
Well, thank you for having me, and so good to meet more of your team. I know we were able to have an initial meeting and start kind of brainstorming on how we can partner. So it's exciting to meet your team, and I'm excited about the RFP and feel a little bit it was kind of a perfect situation for you guys to have had that out, and now we're onboarding and we kind of have a little bit of a cushion to start with to see what's out there. And thank you so much to the committee for that foresight in getting this body of information available for us. So next slide. So I'm Catherine Lucero, and I started on January 18. Elisa Hartz, who is counsel for our office, couldn't be here. She started a few weeks before me. So it's safe to say that you're getting some really early FaceTime with us, and we're still practicing. We're still getting our sea legs. Would be happy to take any feedback on a presentation today or areas that we can speak further about. I was born in Yolo County, 8th generation California on my mother's side, and 2nd generation on my father's side. He's from Mexico, from Durango. I grew up basically in this area, meaning Sacramento Bay Area. After I finished at UC Davis, I went to law school and then as an attorney landed in Santa Clara County working for the district attorney. I was appointed to the bench on by Governor Gray Davis in 2001. And prior to that, I was a commissioner in the child welfare courts for 1.5 years. So my legal career, my judicial career has been spent with families in crisis, either on the child welfare side the family court side, or the juvenile justice side. I retired on January 14th of 2022, and I was the presiding judge of the juvenile division at that time and had been in the juvenile court since 2014. I say all that so that you can kind of see what my path has been. And one of the things that I did when I was in the courts is I was really fond of systems change and having systems meet the needs of people rather than expecting people to meet the needs of systems. And kind of like a human-centered design of making sure that our families who are often involved in more than one court system and more than one governmental organization, help them have a facilitated way to manage the demands on their lives from maybe 2 or 3 different judges or 2 or 3 different case managers, that kind of thing. So I started what was called a family wellness court for 0 to 5 kids in the child welfare court to address the positive tox baby phenomena that we were seeing at the time around 2006, 2007. I started a teen court because recognizing even back then that teens had a different need than say the 0 to 5 or school age kids. I also had a court for the individualized treatment of adolescents, where we had kids that were dual diagnosed with both substance use disorders and mental health disorders, and sought to really individualize the approach to them in juvenile justice court. We used to say that let's have the kids be at home, out of trouble, and in school, and do warm handoffs to the community and have them be off probation and addressing their behavioral health needs in the correct system, rather than sometimes what could be very punitive juvenile justice system. That being because that's our job. Our job in the juvenile justice system is to hold kids accountable, work in the best interest of the youth, look at community safety. But a lot of the youth that we see in the juvenile justice arena, as you probably already know, have behavioral health issues that are not always squarely addressed in the juvenile justice system. And so I was really excited to take this opportunity to join OYCR, and I love it that it's under the California Health and Human Services Department. That shift alone kind of tells us that we're able to really embrace the whole child and the whole family and look at the different root causes that may have drawn kids into systems, into law violations that causes them to come into systems, and then do everything we can, very similar to what Chief Jenkins talked about, looking at the different levels that our kids come in and then addressing those root causes and then helping them get off that pipeline to prison. It is complex work, and it's layered, and it deserves the kind of attention that we're giving these youth. I also have to just point out that having sat on both the child welfare side and the juvenile justice side, that I saw the same kids and the same families in the both court sides, and how we treat kids. It was often different depending on the courthouse door that they came in. So it's really been my goal for us to kind of look at that and think about how our approach could be a little bit enlightened in this area. And, 1 day you're a foster youth and 1 minute you're a probation youth, and it's the same child in the same space of time, came from the same family. But we have this different approach. We've done a lot better with our dually involved youth courts, which I did supervise in Santa Clara County. So I'm very familiar with the work around having a dual status protocol. Not all counties have them, but some do. And so there's again that complexity of that work and pulling out these different populations. I do want to mention that Elisa Hartz, who is our counsel, comes from the governor's office. She briefly worked for the governor, and prior to that, she was an attorney with a nonprofit that ensured certain healthcare rights to children. So she's really perfect for this office as well. I'm so lucky to have her on my team, and she wishes she was here, but she, I encouraged her to go ahead and fulfill some plans that she had made, and not worry too much about being here. And I'm hoping, Brenda, that another time maybe she can come back.
Of course, anytime.
So if we can go to the next slide. So OYCR was created by SB 823. And really, it's a monumental undertaking. It's closing down the statewide youth facilities and asking our counties to realign that population and get our kids close to home so that we can improve outcomes in public safety. We're hoping to reduce the transfer of youth into the adult criminal justice system, continue to ensure that dispositions or consequences are the least restrictive, appropriate environment. Again, the goal around racial equity and ethnic disparities, and to reduce the use of confinement in the juvenile justice system by utilizing community-based responses and interventions. So that this was kind of some intent behind that bill, SB 823. Next. I'm going to talk now about the Office of Youth and Community Restoration mandates and the mission. So the mission of our office, as outlined, is to promote trauma-responsive, culturally informed services. And for our youth that are involved in the justice system, and you can read this for yourself, but it's to support youth's successful transition into adulthood and to help them become responsible, thriving, and engaged members of the communities. So our office mission is broad, and we're hoping to also have it be deep and broad work around, because this is the context that our youth come to us with, all the different parts of themselves and all the different parts of their families. And if we don't get that individualized response right, then we may be missing that golden opportunity to be part of the healing process, so that youth is not forever destined to be defined by their worst decision or their worst moment. Our mission is to help our communities and our families recognize that youthful offenses are that. It doesn't define youth. It doesn't for all time mean that that's their character. This is a really critical time in the life course of a person, this adolescence between, we're really looking at like 14 to 25 when we talk about this population, although there are youth as young as 12 that enter into systems, but 12, 13-year-olds wouldn't qualify for a realignment per se. They would never go into a secure track facility, for example, or to DJJ. But we're really hoping to look at life course frameworks and to improve along the way, to divert youth into systems, to narrow that pipeline, that school to prison pipeline, what we call for our girls and our gender nonconforming youth, that sexual assault to prison pipeline. Really hoping to look upstream, again, based on the literature, based on the science, based on best practices, promising practices, evidence-based practices to intervene. And that's really the mission of OYCR, to become the voice and the experts, to be a beacon in the state, to assist counties, not to have any county be labeled as bad or not doing what they're supposed to do, because this is complicated work. I mean, look how long it's taken us to get to an OYCR. It's complicated work. And I know that counties are doing the best they can, but even in my county, in Santa Clara County, we needed to learn. We needed more information. We needed technical assistance. And so that's what we hope to be as support to the 58 counties. Next. Our mandates are to identify policy recommendations for improved outcomes and integrated programs and services to best support delinquent youth. That's in the Welfare and Institutions Code, and identify and disseminate best practices to help inform rehabilitative and restorative youth practices, including education, diversion, reentry, religious and victim services. Next. We want to be support and seen as supportive rather than unsupportive or critical or judgmental. We really do want to form partnerships where possible, build relationships with counties. One of the things I want to do is have some regional staff kind of strategies and make sure that we're working with people from their own areas and not, have somebody from one side of California be advising another county across the state that may not have the particular jurisdictional characteristics. So we want to provide technical support. We want to develop and expand, as you can see, diversion opportunities and responses, and including but not limited to sex offender, substance use, and mental health treatment. So really a variety of, we want to really be as broadly informed so that we can inform others. And that's why this RFP is so exciting, because we're hoping to really start getting a look at what's out there. Next. And we have a lot of research and data and reporting requirements. Sometimes this population is referred to, especially when it comes to educational outcomes, these probation youth are considered kind of invisible because the data collection mandates are often not as robust as they could be, so that we know things like graduation rates of our youth, probation youth. We don't know that because it's not required data to be collected. So we're hoping to really start to look at what do we need to support youth outcomes in the juvenile justice system, and what reports do we already have. So we're going to develop a report on youth outcomes in the juvenile justice system based on the JCPSS system, which currently exists, but it's being updated. So we're collecting the right information. Evaluate the efficacy of local programs being utilized for the realigned youth, and that's going to be due in 2025. So that'll be a big report. And so we're looking to right now to hire policy data research folks that can help us do that. It's a really, it's going to be a massive undertaking, but I think we're going to see how important it is that we have it all in one place, and we can really take a look and see what's working and what's not working. So next. We also have an Ombudsman unit, and the requirements or the scope of that work is to investigate complaints from youth, families, and staff and others about harmful conditions and practices or law violations or regulations violations that govern the facilities and circumstances presenting any emergency situations, to decide in its discretion whether to investigate a complaint or refer the complaint out. The ombudsperson is going to be able to resolve complaints where possible, collaborating with the facility and staff and other county actors, of course, and develop maybe training. And then the ombudsperson will publish and provide regular reports to the legislature about the complaints received and subsequent findings and actions that were taken, as all laid out in the Welfare and Institutions Code there, 2200C5. Next. We also have the mandate of concurrence with the BSCC on grants. So the law says that juvenile grants shall not be awarded by the BSCC without the concurrence of our office. So we're absolutely building that partnership, discussing what that would look like. Says all juvenile justice grant administration functions at BSCC shall be moved to our office no later than January 2025. So OYCR is going to be taking over that process eventually. Next. As you can see, there's also concurrence with BSCC on facility standard regulations. So I do plan to sit at the table where these regulations are being modified. And this shall be, it says the Board of State and Community Corrections shall by July 1 review existing juvenile facility standards and modify or add the standards to establish and design security programming, education, staffing of the facility that is utilized or accessed by the court as a secure youth treatment facility. So basically it's going from the centralized Department of Juvenile Justice to local, what we're calling SYTFs, secure youth treatment facilities. And so far, we are of the understanding that 17 counties do not have their own facilities. So they'll be doing some regional agreements to make sure their youth have as close to home as possible alternatives to, to any sort of incarceration in the adult system. And so these are important facilities because we don't want to net widen, but we also want to prevent that future, any thinking that the youth has to go to state prison because now that DJJ is closed, what are we going to do? So we're going to be there making sure that these programs are robust, that they have community safety in mind, but also that they're safe, they're secure, and they're designed for a longer term stay because the county facilities were not built for long-term stays. They were built, they're called detention facilities because they were to detain a youth, but not necessarily have that rehabilitative time there. Some counties have both, but some don't. And so that they are kind of turning their detention facilities into these longer term facilities. I've read a lot of the county plans. The counties are planning some really great innovations. They're taking this to heart and looking at the research and data that talks about a trauma-informed and therapeutic settings, how important that is for our youth. The standards shall be developed by the board with the coordination and concurrence of OYCR, established again by that by law. So we're there. We've already had a couple meetings with BSCC, and so we're ready to roll up our sleeves. Next. So yes, and so here we are with the county realignment plans. So to be eligible for the juvenile justice realignment block grants, a county must develop a plan that includes, among other elements, demographics of the target population that we're talking about, which is kids that were at DJJ, went to DJJ, but also all 707B offenses, which is the violent felony offenses that youth were had sustained charges. So it's broader than just the Department of Juvenile Justice youth. It's really an opportunity to look at that whole population and look at programming and services and facilities that can serve them and keep them from penetrating deeper into justice systems. They also have to address programs related to mental health, sex offender treatment, trauma needs, family engagement, healthy adolescent development programs, re-entry, very critical. Some counties say, re-entry is going to start at day one. And I think that's a great strategy. And then the culturally responsive, gender responsive, we want, again, kids to thrive where possible. I know that that's a tough kind of concept, but when youth have to be away from their families and communities due to public safety issues, we want them to be in the maximum therapeutic environment possible, getting everything that they need to emerge whole and to emerge as healed as possible with their families and communities. So also in the county plan is a description of how the plan will keep youth in the juvenile justice system. And we're seeing lots of great ideas on that. A lot of a lot of the counties are looking at the research, looking at how to work with their stakeholder partners on keeping youth home, keeping youth in their communities, keeping youth in the juvenile justice system where possible. And then each county is asked to describe how they're going to collect data, what kind of data points they're going to be collecting, and how they're going to measure outcomes. Next. So our mandate is to review the plan and to assure that the plan contains the elements described in the section, and then return the plan to the county if we see that any revisions are necessary prior to the final acceptance of the plans. And, you know, the counties had to throw these plans together fairly quickly. I know that for some, that might have felt like a long time, but in, you know, getting everybody together, because they had to form a new committee. Then they had to, of course, use the Brown Act to make sure that the meetings were public and transparent. So the plans are you know, they were all on time, significantly answered, each question answered. There's a little bit of a tutorial session, I think, that's going to be going on. And in the future, I hope that we're going to be able to have some literally like technical assistance where we have office hours and we can just say, hey, anybody that needs help with their county plans or has a question, you know, come and see us, because we want to make this work. You know, and in the final analysis, we're talking about youth. We're talking about people. We're talking about making sure that our youth have access to justice in every domain, not just in a court date, as I always say. You know, access to justice is way more than a court date. And so I want to make sure that these youth have the best of us, and that's why these plans are important, and that's why that we want to partner with our counties to make sure that they're what the statute expects them to be. Next. So I mentioned that all the plans were timely submitted. I've had just nothing but good discussions so far with the Chief Probation Officer's CPOC entity. Really pleased with my ability to communicate, and also I've had some great discussions already with our youth advocates who were behind this transformation, if you will, so it's really already off to a good start. Our review process is to ensure faithful compliance to the statutory requirements. That's my role. Identify priority areas for technical assistance and support the best practices, do some training, have grant programs develop around what I'm seeing might be needed in the counties, because smaller counties are different than larger counties. And how are we going to be able to support counties to make this happen? Because really what we're doing is we're supporting families and youth when we support our counties. So we want this to work. And building relationships, of course, is important. And that's why I like that regional kind of approach, and exchanging information, and then back to OYCR, really developing that subject matter expertise so that no matter what's happening at the county level, let's say there's a turnover or a new chief or a new DA or a new judge, you know, we want to be able to say, hey, you need some help, we got it. So next. So to the staffing. So next slide. So we have been given 34 positions, and so Elisa and I have been working really hard on the org chart and on kind of looking at what our team needs to look like. And we are envisioning a really strong leadership team with very deep understanding of some of the subject matters that we need to really understand, and then some of the practices that we need to implement around things like education and probation youth, around things like the school push out phenomena for foster youth, or youth youth with IEPs or 504 plans that are also foster youth or also probation youth, and how we really want that subject matter expertise on ed rights, and how can we offer technical assistance to our counties on that. And then we want to hire a clinician, a behavioral health clinician or a medical doctor who fully understands trauma and can help us with our policies, and making sure that we're really looking broadly at how to help heal youth and help communities heal from the underlying events that brought youth to us. We're also looking at strong evidence-based practices around juvenile detention alternatives, and the differences between girls and boys offenders, and the phenomena of the youth that we see that may have special needs or different needs, or we want to really be able to take the individual populations of youth that we see coming through the door and address their problems individually, or their issues, or I don't even want to say problems. It's kind of because I don't think that we fix people. I think we try to help heal folks. I had so many youth when I was on the bench, and I'd say, how about you and your mom doing therapy together or counseling? And they'd say, that's not for me, Judge. I don't really want to be doing therapy with my mom. So I'd say something like, what about nonviolent communication skills? What about building nonviolent communication skills? They totally wanted to do that. So I think there's so much reframing that we can do that is supportive to our youth and our families, and feel like we're really adding instead of doing further harm. So I'm sorry to kind of get off track, but those are the kinds of staffing people that on my staff that I want. And we're going to have a chief policy research officer who's going to work with the counties individually on those data points that we need and help me with those reports. We're going to have a chief policy officer on the juvenile detention alternatives and working with girls and gender nonconforming youth and kind of the different approaches. The pipeline, school to prison pipeline expertise. We want to have restorative justice expertise. I spoke to someone yesterday who does victim offender dialogues, who has seen a lot of healing happen in those dialogues, and a lot of harm has been addressed in a very constructive way. So I want to have somebody on the staff that really can reach out to victims and victim advocates, and because it's all part of the process of building wholeness for community restoration and youth restoration. I'm really excited about what our team looks like. And then if, we're going to have the ombuds regional work, the county liaisons. We had right now, I think the next slide. So we've posted positions. We posted our DD, got some really great applicants. My assistant was posted. I got 38 applicants. County coordination units were posted. We have had an abundance of interest in this office, and I love it. I love having people around me that feel as passionate about the work as I do, and I hope that we're able to really get our team, on a trajectory to get this important work done, and have people there that not only have that expertise, but really that this is important to them. This is a life goal as well. Next. Okay, then I'll talk about some of our collaborations. So we are participating in cross-agency initiatives. I'm actually on the work group with the Judicial Council. We're actually creating the matrix, the commitment matrix. Right now it's the Title 15 matrix that judges use when a certain crime is committed, and then they go to this matrix under Title 15 and they look to see what the commitment would be until, or it's actually a commitment until their first board hearing. And so all of this is being looked at again. There is not going to be a board hearing. It's going to be a judge. A judge is going to be hearing, if a youth is doing well, if there should be 6 months credit to their disposition time. So this is all something I am working with on the Judicial Council. Elisa is working with the Department of Justice in that JCPSS data group that we mentioned earlier. We are going to reconstitute our Office of Youth and Community Restoration Subcommittee of the Child Welfare Council. And we've already kind of identifying what people need around that and how we're going to be successful. We're interfacing with CDII, which is the Center for Data Insights and Innovation. We really want to be able to leverage and use any information they find or have or around adolescent behavior, what adolescents need, any of the juvenile justice research, whatever they have. We just see this as a very integrated office because, as I started at the top, our youth have significant behavioral health issues, significant trauma, and trauma changes the course of one's life, and it does that in many, many different ways. So we do see this as a lot of cross-agency initiative work, including with the Children and Youth Behavioral Health Initiative. Next. We're engaged with state partners, and before I got here, I was the chair of the CJA Juvenile Court Judges Committee. I plan to continue to work with judges who feel really impacted by these changes and also really want to lend their expertise and knowledge to how to make all of this unfold to the best outcome for our state and our community. Working again with the BSCC, I've met with DJJ director, and we are very much in lockstep here with making sure that this is rolled out in the best possible way and looking at all the complexities together. I've talked with DSS. We share the same kids often, so it's important that we not think that we're isolated. This is a continuum. This is a life course continuum that we have a lot of with certain populations. We see these kids the whole time along the way, and how are we going to make use of that if we can? And then, of course, you all have been great partners. Next. We're also looking at our county partners. So we've been partnering and sharing and interfacing with CPOC. I have a plan on how to make sure we're in communication with district attorneys, since they're the ones that start the ball rolling with those transfer hearings, and whatever they need from us, maybe they need some particular research or discussions, but I'm really committed to making sure that people feel heard, that I hear their concerns, that we talk about, what kinds of infrastructure has to exist so that DAs feel confident and that communities feel safe while we're working in the healing and transformation of our youth. Public defenders, of course, victim services, and youth advocates and advocates that are there to hold systems accountable, because that's important, and we need to not have any blind spots. And so Human Rights Watch, Children's Defense Fund, California Alliance for Youth and Community Justice, and the Youth Law Center, the Burns Institute, the Vera Institute for Justice, Alianza for Youth. There's many advocates who are really pleased with having this entity exist and talking about how we can work together and move forward. Next. And there's my contact information. I feel like I've been talking for so long this afternoon. I am happy to take any questions offline. Email me if you want to if you want to know anything further, please contact myself or Elisa. And I think I'm definitely open for questions now.
Thank you so much, Director Lucero. That was great information, and quite a plate load you guys have there of work to do, but it will be certainly setting up to be transformative. With that, how about we turn it over to our council member advisors for questions and comments.
Thank you, Brenda, and thank you, Judge Lucero. My career was in probation, and as a probation employee, when you interact with judges, once a judge, always a judge. So I'll probably continue to say Judge Lucero, but I recognize that you're in a new position. But that was very comprehensive. And I don't want to dominate the time, but I was taking notes as you spoke. So I have just a couple of comments and probably just one question. But as I mentioned, that was extremely informative, really, really helpful. And I was also very pleased to hear about that you've engaged with CPOC. I'm a former president of CPOC, so I know the organization well, although there's been turnover at the chief level. I'm not sure how many of them I still know, but I just certainly know a lot of clearly probation's role in serving youth in the justice system. And even before I make a couple of comments, I do want to say, I hope if you haven't already, that you look at CCJBH's recently completed report to the governor's office and legislature, because we addressed specifically from some work of this work group, some recommendations around the area of juvenile justice.
Okay.
And if you haven't seen what we put there, I would again encourage you to take a look at that.
Sure.
Because much of what you talked about, there's an intersection in terms of what we put in our recommendations, in terms of examples of programs and just general concepts that we believe should be considered as we better serve the justice system youth. And an example is when you talked about how complex this is, that's an understatement. This is really complex. And you talked too, because it sounded like you had history on the bench on both the child welfare side as well as the delinquent side. And that is so important here. And there have been, candidly, the state has passed legislation in the past to kind of facilitate the better integration and cooperation and collaboration, if you will, between delinquency and the dependency systems. I'll just throw out a term, the crossover youth practice model. Are you familiar with that? Yeah.
Yes, absolutely. Yes.
When I was chief in San Diego, we were a county that was employing the crossover youth practice model. And I will certainly tell you that I had, and I believe many chiefs do, had tremendous working relationships with our counterpart child welfare directors. Because the point that you made is so important, that the youth, and I will tell you, and I will differentiate a little bit, but I like to talk about the chronic users, if you will, of the system. Those kids that stay involved almost always are crossover youth. And if they aren't crossover youth, just as you pointed out, they have the same issues. I noticed you didn't want to call them problems. I understand that, but they are those kids, and all of them have trauma backgrounds. So those are among the things that certainly I've learned over my career. But more than what I've learned over my career is what the current research talks about in terms of how to recognize and focus on a family unit when a family exists, and rather than just the kid. So just a couple of other things I noted from what you were saying. A couple of them I already talked about already, but again, crossover youth practice model and the importance of dual status programs and the ability to determine the best way to serve the youth when they come across. And I liked hearing, I'm glad that you included the mission of your office. And what I will suggest, not just for you, but all of those listening, is that the mission as you described it is very, very close to the original mission of the juvenile court when it was conceived in this country. And not a lot of people who know the history of the juvenile court in this country know that, but they should. And I think some of that is captured even in the original language of the Welfare and Institutions Code. But when you talk about why that office will exist, it closely parallels the whole concept around the creation of a juvenile court. As a probation employee, I am a defender of probation and will remain a defender of probation. And probation has received what I believe is some unfair criticism, some parts of it actually fair, in terms of being more punitive than what is needed to serve the youth. But that was part of, if you will, that was part of a transition period or an evolution period that happened in the juvenile justice system, where probation appeared to become more punitive. But what I will tell you, and I'll be surprised if my colleagues in CPOC don't also say, that probation has always had a restorative approach and restorative mission to youth that come into the system. Their ability and how well that they have employed it may certainly have varied, but that's always been the purpose. That's why it was created, and from a juvenile side. So was really impressed with hearing the mission statement. I was also really very pleased to hear you talk about not forgetting the experience of crime victims. Certainly, we have to well serve youth who come into and penetrate deeply into the system. And we can do that better today than perhaps we can do it 40 years ago. But what also happens somewhat, and this is just from my experience, is the need to well serve and respect the experience of crime victims gets pushed aside. So when we talk about restorative justice, and again, you touched on that as well, the importance of your office having a restorative justice approach. I'm well versed in restorative justice and experienced, and I know a lot about it. And what I like to share is there are no restorative justice models that I know of that exclude crime victims. That because it's always about, you mentioned victim offender mediation. It's just important as we move forward with improving the system for youth, improving outcomes, improving families, that we never forget that sometimes the youth, that there's a victim that's a part of this experience, and we have to always remember that. Let me see what else I was going to say. Oh, and this is my last point, then I'll be quiet. I also really appreciated the fact that when you were talking about the plans that the counties have to pull together, and you said that they had to pull these plans together quickly. So I experienced the implementation on the adult side of Assembly Bill 109, when counties had to pull plans together for that realignment. So what I will just offer here is that when counties have to pull plans together quickly, that's not easy. And it almost always involves a readjustment of those plans. And sometimes that process can solidify collaborations that already exist, but equally sometimes it can fracture them. So I really liked what I heard you talking about in terms of the position that you see your office in, of being a position of support to counties, because they'll need it. From my experience, they will absolutely 100% need it. Just that the experience of trying to bring together a plan for a change this significant, sometimes it goes well, sometimes it doesn't. And you see that in the plans. It's just there will need to be an ability after some time to reevaluate and adjust the plan, is what I'm just saying. But I think you already know that. So I just wanted to make that comment. So I'll be quiet, but I was very impressed with the presentation, very informative. And I wish you all the best. And certainly, as a member of this council and the council itself, will be working to help your office succeed.
Thank you very much, Chief. Thank you.
Dr. Pantoja?
Yes, I just want to make a couple comments. Thank you so much. Your presentation was amazing. Already all the work that you've done since January is, just amazing, and the partnerships that you guys are already working towards. I just want to say it's great, for counties to have that technical assistance that sometimes is missing, and especially supporting the smaller counties. I mean, I'm fortunate, I'm from Los Angeles County, and there's just great resources that we have being such a large county, but having, this department to help those smaller counties, I think will be so beneficial when sometimes they don't have the resources or to have that technical assistance. I know one thing we're working towards, and Brenda and I have been talking about, because you did mention something about data gathering for juvenile justice involved youth. We've been talking, because California Department of Ed identifies certain, their special populations that us school districts were supposed to be tracking and providing more supports to those students. And one of the things we've been talking, that juvenile justice youth be part of those, special, added as those special populations that districts are tracking students and providing, more resources towards, because I think that's a component that we're missing. So maybe that's something you could, your organization can work towards, and that'll help with gathering that data, that's so crucially needed. Even though, like you mentioned, some of those youth are foster youth, students with special needs, they cross multiple of those special populations that we already track. But it'd be nice if we could just track, our juvenile justice population. I'm just excited, this will be, I think, great for all our youth, and that there's there'll be consistency in the counties, basically, and that all our youth, there's the equity part of it, that's important, that all our youth will be getting that support and the resources that they all deserve and need throughout all of California. So congratulations to your team, and looking forward to our partnership.
Thank you.
Dr. Pentola's comments made me remember one other thing, and I'll be quiet after this, but one of the things, and I'm sure every chief that you talk to can tell you this, but one of the challenges with these youth that we saw was re-engaging them in their local school districts, because many times the school districts don't want them. And it is a struggle to try and get them back productively and successfully into those local districts. So, but anyway, I wanted to make sure I made that point.
Yeah, absolutely, Chief. There are tools that have evolved more recently, where there's now a county can have an MOU with the school districts to dually enroll the kids in both the court school and the homeschool at the same time for 30 days. So they never have to go back and forth on the books. But a lot of counties don't have those MOUs yet. So that there's some tools that we can help do some TA on. And, when you were talking, Chief, I was thinking about how it's child welfare that we need to partner with, but it's also behavioral health, County Office of Education.
Absolutely.
We have immigration issues, we have homeless issues. Those are, the special populations that we are identifying, the homeless and the foster youth. But really, I really see us working together because that is the whole child, right?
Absolutely.
When we look at that. So it's not all, I think putting it all on probation is certainly, I think they could rise to the occasion, but I think that I don't know that that's the most efficient thing to do.
And I wasn't suggesting that. I was suggesting the collaboration that you're exactly the collaboration that you talked about. Child welfare, behavioral health services, Department of Education, except absolutely.
Yeah.
It's a collaborative effort.
Yeah. So, and I'm hoping that we take, that if more hands make light work. So, and those agencies who often work in silos, often they're not able to share information because of HIPAA and FERPA and some of the other limitations. But I'm not a limitation believer, and I happen to know other people in agency are also not a limitation believer. I think that we can figure out how we can work together, and so yeah, I'm hoping that we're going to be able to reach back to the counties and not just overburden probation, but say, who else can we work with in your county? Who else can we provide technical assistance to, so that we make sure that this child is well served?
Wonderful.
Yep. And I was actually just going to add that you guys actually took the conversation where I was about to take it with, because my former life being in healthcare services and with Cal AIM, there's healthcare services as another partner in addition to CDSS, plus the County Behavioral Health Directors Association of California, which is kind of like a CPOC counterpart for behavioral health, and then their provider associations as well are also going to be great things. So we can move the health and behavioral health care closer to the justice system. And I think CalAIM's already doing that because of with the 90-day in-reach proposal that DHCS is working with the Centers for Medicare and Medicaid Services on, so that they can do that in-reach up to 90 days prior to transition back to the community. I know DHCS and probation is having those conversations right now. And so that'll be a great opportunity for resources, as well as the new benefits in CalAIM for like enhanced care management and those community supports. The other thing I was going to put on your radar, Director Lucero, is that the California Interagency Council on Homelessness is going to be having spin-off work groups. They're going to have a justice-involved work group that starts in fiscal year 2022-23, but also they're looking to have a children and youth work group as well. So that might be another good place for synergy.
Thank you. Yes.
Okay, so with that, if our council member advisors don't have any other thing to say, then we can open it up for our participants to share their thoughts or ask questions. Monica, would you mind facilitating that for us?
Absolutely. So it looks like we have a hand up here. I'm going to go ahead and unmute Wayne Garcia. And Wayne, you should be able to unmute yourself now.
I did. First of all, Wayne Garcia, Chief of Reentry Projects for Amity Foundation. First of all, Dr. or Judge Lucero, excellent presentation. I've been doing this for 30 years. I'm used to dealing with the old California Youth Authority, where there was no hope, to be honest with you, when someone was leaving. And I'm proud to say right now, the Amity Foundation, we just begun services at the last 3 DJJ locations. We successfully activated services at OH Close in Chad, and then on March 1st we'll be at Ventura. So any help, and everything else we can throw in there that we can be, please call on us. We will be providing services using evidence-based curriculum with the, we call them students, we don't call them wards like the old days, or participants or clients with the students. We're very excited. We will be there to June 30th, 2023, or let me just put it this way, until the closure of DJJ, because we still have close to 700 students throughout the 3. So I'm just very impressed by your presentation. Like I said, I've been doing this for many, many years with both the adult and juvenile justice population, and this is a breath of fresh air. So any help to myself or Doug Bond, our CEO, who's also working with Los Angeles County on the placements of individuals coming back to that county, we welcome, and we just thank you for your help and support.
Thank you. Thank you for your good work.
Thank you.
Monica, it looks like we might have some Q&A.
Okay. Okay, so it looks like we have a question from Stephen McNally. Can anyone speak to a working collaborative model in California or elsewhere where the implementation works?
I guess I would want a clarification on the implementation. I'm wondering if you're speaking to a particular model. Are you just speaking of collaborations?
Maybe we can unmute. Yeah, Mr. McNally.
Mr. McNally. Yes, it looks like he raised his hand, so I'll go ahead and do that now. Mr. McNally, you should be able to unmute yourself.
Hi, this is Steve McNally. Can you hear me okay?
Yes.
Okay. To be honest, I'm a novice in your arena. I'm very familiar with mental health, behavioral health. I just like this group because the presentations are good and the people speak. I'm a family member. I'm appointed to a county behavioral health advisory board, which is the state mandated mental health boards, which are all 59 counties. by WIC code, but have been pretty much marginalized by the local healthcare agencies. And it is one of the few, like in my county, we have 90 boards and commissions that are appointed. This may be one of 2 or 3 that actually have community members in charge of it. So the question really is, like CalAIM, a lot of the planning is really smart and it's really well done. And I think to Commissioner Jenkins, it's, you know, if we would just do what we originally were doing and actually did what was put in statute and did. I made the comment earlier, and I apologize because I was just venting because of a frustration of something going on in our county, where care less about the feelings of the counties and care more about the system users and the families that are using your systems, because we're so left out of it. And by the time you ask for any input from system users, it's already 95% implementation. I'm not saying that's your situation, but it's the way the state of California works. And so again, for what you're proposing, where does it work and who collaborates? Because in CalAIM's situation, as they roll it out and try to implement it, hiccups are starting to appear in this meeting, in a general meeting. They're appearing at the pharmacy benefit meetings. And so there's a lot of blockers between you and us, the families and system users. And you're going to be using that same group to implement it. And so, so again, is it working any place? Like what models? What counties actually work well together across the silos? Who can we emulate? And just be aware that 4 counties in Southern California, LA, Orange County, Riverside, and San Bernardino, if we were to organize together, represent 45% of California, America's 5th largest state. We share 1 TV market, and for the most part, 1 radio market, and only 2 newspaper groups. So anything that you'd want to do, and with COVID's, with the open vacancy rates now, maybe people might be more interested in doing MOUs and across counties for the different entities. Because LA Department of Mental Health, I think they said they're 31% open currently for vacancies for their staffing. So I know that's a lot, but the basic question was, where is it actually working? And you can't legislate collaboration.
Yeah, you're right, Stephen. Thank you for your questions and your insights. I come from Santa Clara County, which is a county of 2 million, so it's not as big as LA. But we did a lot of very important collaborative work that resulted in real help for real people, as I like to say. We closed our truancy court, which was a very punitive approach to when kids weren't going to school. And that was in 2016. It had been in existence for 40 years. And we realized that we were fining kids thousands of dollars and taking their driver's licenses away when we didn't really understand why they couldn't get to school. It was also an equity issue because some families were allowed to travel to Europe for a month and the school district didn't say they were truant. But, 3 days truant from a youth on the east side meant they were in trouble. So we closed that court and we forgave the outstanding fines and fees. It was a lot of money. We restored driver's licenses. And we approached the truancy issue as a behavioral health issue and not a justice as a law enforcement issue. And that took the collaboration of the DA, probation, the schools, the judge, probation, if I miss them, and behavioral health, because we also ran some numbers and found out 30 to 60% of the kids who were called truant also had open behavioral health or mental health cases, like from zero to school age, right? And school age. So we started seeing this in a different way. And we're now calling it a school climate or chronic absenteeism issue. And we're hoping to get kids into their best school placement instead of ordering them to go somewhere they're not comfortable or not safe, or that they have to walk through a neighborhood that they're not safe in. So I'm just giving you an example of a collaborative that worked. We also worked with the Vera Institute out of New York. We were one of 5 jurisdictions to end the incarceration of girls and gender nonconforming youth, because the girls, after a deep dive, were usually low to moderate risk and not actually in need of custodial intervention. But we didn't know what to do with the girls when their parents wouldn't take them or their foster home was no longer available. And this is a huge overlap issue with our foster kids. So we developed alternatives that were not carceral alternatives. And we're actually in the middle in Santa Clara County of building what's called a short-term residential placement, STRTP, for our girls and gender nonconforming youth who can't get home. And they're in this middle place of not being able we don't want to use jail as a safe place while we wait for a place for them. I left on January 14th, and we started that campaign 3 years ago. And we would generally have anywhere from 15 to 20 girls in custody when I started this campaign. And we had 0 girls. And we many days had 0 girls in custody because we responded appropriately as a collaborative. All those people I talked about earlier were at the table: behavioral health, child welfare, probation, DA, defense. And so those are smaller examples, Stephen, but that's why I have hope that if we can get some of those models to other folks and to other counties and other jurisdictions, and kind of look at lessons learned and see how we broke down those silos, that maybe we can make a difference in more places.
I was also going to flag too, and thank you so much for that, Director Lucero. For those who might not be aware, there was some interagency collaboration mandated a couple years ago with AB 2083, where each county was established or required to establish a MOU, a memorandum of understanding with one another on how they would collaborate through interagencies for serving foster youth. So that's a nice model out there. I popped that into the chat for anyone who might be interested in learning a little bit more about that effort.
And Stephen, you can get information on the educational work that we did from NICL, the National Center for Youth Law, because they're there helping us with our Justice Ed program. We are calling it Justice Ed. And then with the girls' work, we did that with the Vera Institute for Justice, and I'm sure they have information on their website.
That's great. Thank you.
Thank you, Director Lucero. It looks like we have another question from Robert Forte. I'm going to go ahead and unmute Mr. Forte. You should be able to unmute yourself, Mr. Forte. Ask your question.
Thank you. Thank you very much. It's a pleasure meeting you, Director Lucero. Greetings, Ms. Groshen and your team, and excuse me. So my question directly relates to quite a few statements that you made initially in describing the OYCR and its mission. And Ms. Groshen actually opened a segue in regards to the Medi-Cal Act and Senate Bill 428. And how that population would be addressed and screened. So basically, my question is, in regards to having a full understanding that most of these problems are symptoms of a bigger problem, and you described that problem as specifically being trauma, will you or your organization implement trauma screening the way that it is described in Senate Bill 428 from the Surgeon General. And beyond that, if you were looking at really getting solution-based to creating real answers to data, will you be open to entertaining a justice-involved screening tool for youth that's pre and post? So you screen them when they come in and you screen them when they leave. And this is to do with what our past system didn't do. And that was to rectify problems that we couldn't identify. But if we start off screening up front, we can identify the problems when the youth leaves, because we can attest to what he incurred while he was incarcerated, or in, as you described it, the secure youth treatment facility.
Mhm. I'm a huge fan of trauma assessments. I think that will be left to the counties, because we're not, we don't regulate what they use as much as ensure it's evidence-based. I think the folks that we're going to hire, like our chief policy officer and our education policy specialist, our clinician, will be providing the best evidence-based programming to the counties, and will trauma-informed programming that's actually called out in the vision. But exactly if like there's going to be an ACEs assessment or a trauma assessment, we could certainly promote it. And I agree with you, sir, that it is very important that we assess that pre and post. And but again, it would be up to the county to use those kinds of assessment tools. We also have to remember, unfortunately, that these kids are so over assessed and over interviewed and over diagnosed. And so I think that counties I know that we were in Santa Clara County grappling with, how many assessments and how many times do they tell their story, that kind of thing. But I really like your idea, and I certainly am have a kindred spirit in that thinking.
Quick question, and yes, good afternoon, Chief Jenkins. I wanted to, when you lead to the statement of best practices, and then I heard the lesson you learned with the truancy event. How long did it take your Santa Clara County to understand that you learned something from that? And I say that because as we move into the future, we should be adapting adaptive practices instead of best practices. Adaptive practices are things we learn today and we learned yesterday that will work tomorrow. And it shouldn't take us a year or 6 months to implement policy change to make those kind of changes with our youth.
Mm-hmm. Yeah, and I think the decision to close the truancy court was based on a lot of information we had about how inequitable the truancy statements themselves were. So we had a lot of information that helped inform me and my stakeholder partners. And you're right, we haven't studied necessarily what that means to close a truancy court and to not penalize truants. I'm sure that there are people on the planet that have studied that. I don't believe we studied that specifically in Santa Clara County, but we certainly learned that that we wanted to treat our youth differently, that we believe it had better outcomes for families and youth to relieve them of those huge fines and to have them emerge adults with huge truancy fines. So I don't know if I'm answering your question, Robert, but I will certainly defer to those who may know more.
Yes, ma'am, I appreciate that. And one last quick question in regards to equity. And this question is about program design. Since the data shows that more children of color and minority children are prone to be victims of violence, and then they act out in violence, and that act usually precludes them from 80% of the programs that other children have ability to access. Are we going to be removing exclusionary factors from programs just because of the child's act?
I guess I would, can you give me more specific, like what program a child might be excluded from?
Well, I know there's programs that are designed that if a child is violent, he doesn't qualify for that program. But that at one point in time, that child was the victim.
Sure.
And so whether it was public safety or the county itself, it failed the child. So now we're holding the child accountable by not giving the child equitable access to programs.
Sure. And we see that happening on school campuses, for example, when kids get suspended or expelled. And we certainly see that in what we call collateral consequences, when a youth has a sustained petition for a crime, and then suddenly they don't, they may not have a record sealing opportunity, or they may not be able to join a military force if they wanted to be a soldier, or maybe there's some college issues there. So I certainly know what you're talking about, Robert. And I think that's why there's a huge emphasis in the juvenile court at this time to look at record sealing wherever possible. And I know that in our county, there was a robust protocol with the district attorney if that particular offense might have a consequence on an immigration pathway to citizenship. So I think these discussions are being had, and your point is well taken. So thank you for bringing that up.
Thank you so much. And the other thing I thought I'd throw in there is the state's ACEs Aware initiative and the work that's been done in the Medi-Cal managed care plans to really build out trauma screening in primary care. And so I popped the ACEs Aware website into our chat box for anyone who might be interested in learning a little bit more about that. And I think it just really shows it's just another reason why for bringing probation and primary care and that healthcare system closer together, which I know primary care, Medi-Cal managed care plans are new in this space of the justice involved, both for kids and adults. And so really getting those connections together, I think for trauma just across the board will be really critical. And there's a lot of opportunity to be able to do that right now with the CalAIM initiative and ACEs Aware. Okay. I'm not seeing any other questions or hands raised. So with that, well, I want to say a big thank you, Director Lucero. It is not lost on us that we are so fortunate to get you early and get your time, because we know everyone's going to be clamoring for it. So appreciate the partnership we'll be able to have together, as we work through the RFP in the months, and we'll continue to track the work you'll be doing. And if there's ways that we can be of assistance, please don't hesitate to let us know. And we'll just look forward to you staffing up and all the wonderful work that's going to be ensuing or happening in the ensuing months. Okay, so with that, I think we just have one slide, our last slide, so I can put a few things on folks' radars. So our upcoming events, we have our diversion and reentry work group. So today was our juvenile justice work group. Our other work group that we hold is diversion and reentry. Unfortunately, we had to reschedule that because our presenter was not available on our originally scheduled date. So the next scheduled date is going to be on Friday, March 4th from 1 to 3 p.m. And I know Chief Jenkins, we're losing you on that. And so that's sad. We always love having you, but we'll have a recording and we'll make sure we get that recording to you, because it's going to be a good thing, I think, for you to see. It's going to be the Riverside County Whole Person Care pilot program that is now switched over to be full CalAIM. So they have, as of January 1, 2022, converted over, because they were a whole person care pilot, they were mandated to convert over to CalAIM. And Riverside was one of only a handful of counties that focused on the justice involved population for the whole person care pilots. Other whole person care pilots serve the justice involved population, but Riverside County and like LA, Placer, and I think one other one that's escaping me right now, focused solely on juvenile justice. So we're really excited to have Riverside County come and talk so we can see how CalAIM actually can look on the ground. So In addition, we have from our housing report launch that we did with CSG, the Council on State Government's Justice Center last summer. We had started a webinar series to go do a deeper dive in the recommendations from that report that was disseminated last year. It's called the Housing Recommendations Implementation Webinars. This one that's upcoming is going to be on common practices for connecting to and using housing as a strategy for diversion and reentry. Again, this is a third of the series. The series is 5 webinars that will be running until April. This is funded by the California Healthcare Foundation, and the Council of State Governments Justice Center is doing these presentations. Past presentations are on our website for those who may have missed them. You can go back and watch those. But if you want to sign up for the next one, we have the link there in our meeting materials. And our next CCJBH full council meeting will be on Friday, April 29th from 2 to 4:30. And we will have the SHORE program presenting, which is substance use, respite and engagement. As a Sacramento-based program, really exciting program that I had a chance to tour last summer. And so we'd asked them to come and talk about a program that they have, which is kind of like deflection, like basically when law enforcement encounters folks in the community who might be looking like they're under the influence or having a mental health or psychiatric episode, instead of taking them to jail, they could take them to this alternative site that's located a block from the Sacramento County Jail, and they can instead be processed in through a treatment pathway versus a criminal justice booking pathway. So it avoids that booking. So it's really exciting program, lots of opportunities with DHCS's behavioral health, the infrastructure, the BCHIP grants, as well as with CalAIM, different funding available for these programs. So we'll get to see how one of those programs is brought to life, because ideally we want to deflect people from the system so that they don't enter the justice system. Alongside, and that's in accordance with our goal number 1 at CCJBH, which is to reduce the prevalence of individuals with behavioral health conditions who are in our jails and prisons. So the more of these programs, the better. And this is a wonderful time to build these out. And so CCJBH is really excited to be able to host these kinds of webinars to get these wonderful, great practices out there. And so folks don't have to reinvent wheels as much as possible, because a lot of hard work is already going into these programs. As always, we have our website, and anybody can email us at any time. We are always monitoring our inbox. And so if you have a thought after this meeting or have ideas you'd like to share with us, please don't be shy. Feel free to use that email address. And if you would like to be added to our CCJBH listserv, we also have that link as well. And with our listserv, we'll put out, at least we try to do a Friday email every Friday with the latest and greatest in terms of what work we're doing, but also any related work that our system partners are doing. We try to get that out to everybody. So that's the type of information that we do in our listserv, as well as any ad hoc or time-sensitive things we might do a little bit earlier in the week if needed. So with that, again, a big thank you to Director Lucero and her team. And thank you so much. Thanks to everybody who attended, our participants, and thank you for tracking our work and providing your expertise and your time as well. So with that, I think we can conclude, and I wish everybody a wonderful weekend. I hope wherever you're at in the state, it's going to be as beautiful as it's going to be here in Sacramento, because it's about 70 degrees here. So take care, everybody, and happy Valentine's Day.
Thank you, Judge Lucero.
Thank you. Bye-bye.
Bye-bye.
Bye, everybody.